Thomas McGinn, MD, is Senior Vice President and Deputy Physician, in Chief at Northwell Health and Director at the Feinstein Institutes for Medical Research. Ankita Sagar, MD, mile/hour is Director of Ambulatory Quality for Medicine Service Line at Northwell Health. Ankita Sagar, MD, mile/hour is Director of Ambulatory Quality for Medicine Service Line at Northwell Health. The views expressed in this commentary are their own. View more opinion at CNN. At the height of the COVID-19 pandemic, the nation witnessed firsthand the pressure and challenges that face our healthcare system when hospitals and healthcare providers deal with high patient volumes. At Northwell Health, we took care of far more patients outside the hospitals than inside the hospitals. Through all this, we learned that COVID-19 patients required an unprecedented level of care. But there is much more to this story. Variations in testing protocols, slow return of testing results, difficulty identifying asymptomatic carriers, and differences in public commitment to infection control have posed a major challenge for primary care clinicians. While testing capabilities have improved since the early days of the pandemic, the U.S. Centers for Disease Control and Prevention's frequent changes to testing recommendations for COVID-19 risks are causing more confusion for clinicians and the general public. This will also stoke more anxiety, confusion, and frustration as we head into the Twindemic fall season with influenza and COVID-19. The 2018-2019 flu season saw approximately 35.5 million influenza cases with over 490,000 hospitalizations. Our hope is that number will be far less for this flu season given the use of masks and social distancing. That said, as we enter the 2020-21 flu season, testing for influenza and COVID-19 will be critical, as it will not only help diagnose respiratory illnesses, but also determine the prevalence of influenza A, influenza B, and COVID-19 in our communities. Through testing, we can better understand the need for home monitoring and the implementation of contact tracing. A national primary care testing strategy should be implemented that will take into account the availability of testing materials and access to testing sites. Managing respiratory infections will be like planning a long rush hour commute in a mix of rain, ice, sleet, and snow. We need to clear the roads and navigate as best we can to develop this testing strategy for symptomatic patients. Time is running out and we need to forge our path now. So how does this national testing strategy work? Historical data on viral illnesses considering historical trends in patient volume for respiratory illnesses and monitoring current trends in the Southern Hemisphere whose fall season has already begun may be helpful in anticipating the minimum volume of respiratory infection visits in the coming 6 months. Adjusting this data to account for new demands due to COVID-19 will be critical and should take into account the need for testing asymptomatic family members, testing based on exposure to an individual with COVID-19, or testing triggered by a simple runny nose. While not an exact science, combining historical data with anticipated additional demands may allow us to estimate the volume of testing demands for the near future. Triaging and evaluation considerations during the initial COVID-19 surge in New York, outpatient clinical sites offered in-person visits and telemedicine visits, both of which should be leveraged this fall and winter. The decision to evaluate a patient in person or virtually will be dependent on the patient's age and comorbidities such as diabetes and hypertension. Site-specific factors, such as size of waiting rooms and ability to test on site, should also be considered. The one-size-fits-all approach to testing across the nation is unlikely to garner success, given the diversity of patients presenting with symptoms and practice site capabilities. Testing availability and types across a given region. Testing sites may include primary care practices, laboratory service centers, standalone testing centers, affiliated urgent care centers, and home testing for homebound patients. Access to PPE, appropriate social distancing capabilities in offices, space and staffing for drive-through testing must also be considered. Use of combination tests that would test for influenza A and B, and COVID-19, among other viruses, is key. Delineating a clear testing process, setting attainable goals for testing appointments, same day versus next day, and ensuring communication of testing results cannot be overstated. We have learned a lot about the virus over the past 8 months, and we understand the testing needs much better now, including the strain it puts on our local and national economies and the medical supply chain. A coordinated approach would not only lead to more effective testing processes, it would also reduce unfair and unhelpful competition and hoarding of testing supplies. Thus, it would reduce supply chain issues and unequal distribution of testing across communities. National guidelines and expectations. We need to set clear guidelines about which patients should receive tests for influenza, COVID-19 and other respiratory infections, how to perform testing, and a standard set of best practices for medical professionals. Recommendation of testing type should depend on the particular test's accuracy and the prevalence of disease in the community at the time of the test. This will allow the testing strategies to be adaptable by region throughout the fall and winter. Furthermore, while nasopharyngeal swabs, administered by healthcare professionals, are the predominant manner of testing, at-home testing kits are possible options to consider, but again in the right clinical scenario. If we do not have a systematic plan for testing, it will surely result in chaos, which is likely to lead to confusion, anxiety and ad hoc testing guidelines, leading to errors and continued poor COVID-19 outcomes. While the strategy may evolve and vary along with the trends of influenza and COVID-19, the need will inevitably escalate as flu season sets in. A national strategy for respiratory viral testing is prudent, necessary and urgently needed.